Welcome to this edition of the First Aid Show. When the EMS treat a patient, accident and emergency departments are not always the best place to take the patient. We asked a paramedic what they consider when deciding on the best treatment pathway.
So if we feel that hospital isn't the place that will provide the best care for the patient, we can look up phone numbers and alternative services that can provide aftercare for the patient that avoids them going and filling up A&E, because A&E isn't always the automatic route and destination for every patient. Often the ambulance service is called to respond in a public place, or we go into people's homes or businesses, and it's very common nowadays that people will tell us, oh, I watch all the programmes on television, we know what happens, we know what you're going to do. All I would say is we treat every single patient as an individual, and it's our job to provide the best we can in that given day, that given situation, with the symptoms and signs that they're presenting to us. And there are a number of options available to us that might not make it onto the television because it doesn't make great television. So all I would say is, if the crew ask you, could you give us a minute, or we need a bit of privacy, or could you go and find something for us, just understand that they have been doing this job, they are trained in this job, and it's in the best interest of the patient. They're not being ungrateful for your willingness to assist.